Hey everyone, it's Beyond the Session, the podcast where you get to know your therapist before they get to know you. Today's episode is Mindful Moments, and we're talking about how to use awareness as a technique in mental health. When I was prepping our podcast schedule, I asked my good friend ChatGPT to give me a catchy tagline for today's episode. It said, "Unlock the therapist diary and discover the unfiltered thoughts they keep hidden during sessions." Did you bring your diary today, Sarah?
The diary of my mind.
So I've got Sarah Graham here today. She's a registered psychotherapist, and we're going to unpack what it means to be mindful and how to use mindfulness in psychotherapy. Hey, Sarah.
Hi, Kathleen.
I want to know, what on earth does mindfulness even mean? And so I grabbed a definition of mindfulness from Psychology Today, and it says, mindfulness is a state of active, open attention to the present in which you observe your thoughts and feelings without judging them as good or bad. Can you give me some examples of what mindfulness is or is not? Is it the same as meditation? And how do you incorporate mindfulness into your sessions with clients?
So mindfulness is something I think is actively leaned into and utilized both in therapy and also in pop psychology. The idea of mindfulness, from what I understand in a pop psychology perspective, is really just like being present and focused and aware on what's going on around you without that active thought, kind of like the definition that you read. When you bring mindfulness into therapy, it really becomes about the way that the therapist interacts with their clients and encourages them to use mindfulness. And so myself, as a therapist, when I talk about mindfulness with my clients, I'm actually not really direct about saying, this is mindfulness. Let's incorporate mindfulness. What do you think about being mindful in your daily life to reduce your stress? Instead, with myself and my clients in mindfulness, I encourage them to get connected with what's going on for them and then being aware of that inner connection so that they can witness it in those present moments.
Yeah, I love that. And I love how you're not labeling it for clients, right? Because I think there's maybe some stigma around the term.
Yeah, and you're right. Everyone has an idea about mindfulness and it's associated with meditation. And there are some people, like I've had clients who come in and say, listen, I don't want yoga. I don't want meditation. I want to fix my problem. And I don't want to sit quietly and do it.
Right. Yeah. Because there is like a spiritual implication for some people with mindfulness,
Yes.
right? Because I was reading a little bit about it, and it draws from, Buddhism and Hinduism. And there is like that very real spiritual approach, which some people may not subscribe to. And so then they find it uncomfortable.
You're right about it being drawn from like Buddhism and more of those Eastern cultures that have that spiritual element in their culture. And a lot of us come from a Western culture, but a lot of us lean really heavily into the Western culture. And we're not yet tapped into that Eastern side of the world and the way that spirituality shows up in ourselves as people, separate from where we live.
How do you kind of talk to clients about that when, if they're concerned about the spiritual implications of it? How do you talk to them about mindfulness and describe it in a way that, it can still be a tool that they're using to benefit their mental health, but it doesn't have to have spiritual implications necessarily for them?
So one thing that I do as a clinician is when I have a client come in and they say, hey, I know about this therapeutic intervention, or I've heard about this strategy and I don't want it, I say 100%, we're not going to use it. If I have a tool or a strategy to give to you, it needs to be something that you want to do, and it needs to be something that resonates with who you are and where you are right now. Mindfulness does end up coming into therapy, but again, it's for myself, it's not, hey, this is mindfulness. Let's sit, let's think, let's reflect, let's be present in the moment. It's what's going on for you. Let's take a moment to check in session, what it looks like to check in, so that when you're in these high stress moments, you can recall what checking in is and then sit in that space. And then we deviate out from there. Well, what do you need when you have that sensation to move into a more calm state? What do you need when you come to this check-in so that you can reduce the stress that you're feeling, right? Like your nervous system is off the charts because of an interaction or a perceived meaning in an interaction. And so I actually almost never say to my clients, we're going to use mindfulness.
Yeah.
I ask them who they are, where they're at, and then I give them tools and strategies that have them always checking back in with themselves and then sorting out what does it mean to be calm in that high stress moment that I seem to enter outside of session.
Could that be a working definition of mindfulness? It's checking in with myself.
I think it could be, because if you unpack the word mindfulness, right? Ness being like an aspect of, but it's the mind and it's being full of it. And so when you put it all together, well, what's going on in my mind, and how am I paying attention to the thoughts that I'm having? How am I paying attention to the sensations in my body, which we could totally go in a whole direction with this, but like on a very like basic way, the things that we feel go through our nervous system, and it's tapped into through our mind, through our brains.
Yeah. So if I was completely new to therapy and I walked in and, I'm on edge or I'm having high anxiety and I'm not aware of my mindfulness or I'm not checking in with myself, how would you help me to do that? Let's practice. I'm your client and I'm sitting here squeezing my hands and just like very uncomfortable. How would you kind of help someone to do that?
Well, this I think leans into the importance of building a therapeutic relationship. When a client first walks in, I make it very clear that I don't have the most effective tools and strategies for them as a person in this first session. The way that I develop that relationship and engage therapy with my long-term clients is I set up the understanding that I have to learn about who they are and how they function before I can give them anything that's going to be useful for them. Because it's that whole like one size doesn't fit all. If a client comes in, they're like, I'm super anxious, it's my first session, and I just need to not feel anxious anymore. I'm like, yeah, feeling anxious sucks. Tell me about how it shows up in your life.
Yeah, that's great. I want to talk about different techniques of mindfulness because I know there's different strategies that different therapists will employ with their clients. And, just off the top of your head, what are some different techniques you can think of and maybe some benefits of each technique?
Yeah, so there are breathing techniques. The 5, 4, 3, 2, 1 is a kind of, it is a mindfulness technique in that you're pausing and you're focusing on yourself, not necessarily the external moment around you, but what is going on for you. And then you're regulating your body through breath. There are other breathing techniques like box breathing is really well known.
Okay. What does that involve?
When you're doing box breathing, it's like holding your breath. So you breathe in for a certain count, and then you hold your breath. Your exhale is longer than when you've inhaled and held it. And what that does is it allows you to pull up that energy and that air that's been stagnant in your body, which is also contributing to the physical state you're feeling. And you're activating the sense of breath and of controlling your breath, and then pulling out maybe 1 or 2 seconds extra of air to exhale. And you do that on repeat.
Right. And it's giving you that chance to like, remember I'm breathing, right? Like focus on the basics of how your body is working and thriving, right? And just, bringing that awareness back to your breath. I like that.
Yeah. Another technique, and I actually just suggested this to a client yesterday, was that, and for them, they're just feeling really stressed. There is a lot going on in their life, and they do not have a moment where they're not thinking about the future. They're always planning and preparing and doing and focusing and recalling, and they're so active, okay, in their minds. And so a technique that I encourage them to use is to actually just to sit with a hot beverage for 5 minutes in the morning.
Mm-hmm.
And that was that.
Yeah.
And that is a mindfulness when we just sit and we pause.
Mm-hmm.
And some people you can encourage, I'm going to make my mind absent of thoughts. There's a different way that you can bring in that too. So some people absent their mind of thoughts. Another is just allowing and observing.
Mm-hmm.
And in the mindfulness technique that with this one specific client, I simply said, sit for 5 minutes. Are you able to do that? You find out kind of like, what's the access like?
Yeah.
And since they were, just sit there.
Yeah. No, and that's something, I'm hearing that and it resonates with me because I know you probably feel it too as a busy mom, right? You're working, you're managing kids and everything else. And, giving yourself the permission for that space, saying, hey, I need 5 minutes here. I need to sit. I need to rest. I need to check in.
Yes.
And be present today, not just go on autopilot and not just be in crazy task-oriented mode, and just be myself today, right? I want to be me. I want to hear my own thoughts and have a moment even to think about, what do I really want to get out of the day even? I'm not very good at clearing my mind of thoughts.
Well, and even that question, I would say, is like the next level, or level 3 of sitting mindfully.
Mm-hmm.
Something that I like to encourage for my clients, and it takes out of that fear of meditation, which is silencing the mind, which is nearly impossible, truly, because we have so much noise around us all the time.
Yes.
And all different types of noise. When I suggest mindfulness in the ways that I suggest it as a therapist, when they're sitting there, there's something called Shambhala meditation, and sometimes I'll explain it to my clients, other times I don't, but it's simply allowing yourself to sit without those plans, without those tasks and the orientation towards them, and to let whatever thoughts are coming through just come through.
Yeah.
But don't grab on them. And be like, oh yeah, I do need to get gas. Where's the gas station? No, just observe, oh yeah, I need gas.
Yeah. Yeah.
And then it moves on.
I've heard of people doing that and just like writing down those little thoughts as they come in. And it's like, now it's on the paper, right? It's like, I've taken it, I've given it space enough so that I can put it on the paper, but I'm dealing with it later.
Yeah. I love that. I love that. So it's the exact same concept, and it can be used in so many different ways. So for child therapists, which I am not, I work with persons who are 12 plus. And you can sometimes do this with like a 12 to 16, 17-year-old, depending on where they're at in their comfort. But you get to whisper to a stuffy or a teddy bear all the issues that you're facing, or the stress, or like just the things in your mind, and you've given it away to this, like to this object. It works really well for children.
Yeah.
And another way to do that in the same vein, in the same concept, is for grownups is, again, you can just kind of like write out your list. I love this. And I got this from Lisa Nichols, who is like a phenomenal self-help. I call her a guru. I don't think she calls herself one, but she is in the world of self-help. She is not a clinical therapist. She's not a clinical mental health specialist, but she helps people with their self-growth and self-development. And she has lists. So, you know what? I'm feeling burdened. I have all these expectations, all these things that I want to do. And I'm really just frankly overwhelmed and unhappy. Okay, let's organize it, right? Let's use that left brain. Let's just organize it, because sometimes when things feel chaotic, when there's a little bit of structure, it feels easier.
Yeah.
And her lists are things I would love to do, things I need to do, things I would love to do but will likely never do.
Yeah.
And when I went through those lists, I love this. My list of things I would love to do but will likely never do was, I would love to dance professional ballet.
Amazing. That's so good.
Yeah, I would love that. When I look at my life right now and the decisions that I am facing in terms of, you know, what do I have to do each day? What are my current goals for the life that I live in right now? Learning ballet to an extent of being able to dance professionally just doesn't fit in. And so it's a beautiful dream.
Yes.
But it's not something I'm going to do.
Right.
And so I get to get real with it. And it's not, you know, tingling in the back of my mind, oh, I'm not a professional ballet dancer and I really wish I would have been and I wasn't. And now I have regret about all these other decisions I've made, because if I made different ones, then I'd be professional as a ballet artist. And instead it's just like, yeah, like I think that's phenomenal and I'm not going to do it professionally.
Right.
And one thing that opened up for me in being able to be honest that was a dream, not going to happen, was that I went and signed up for jazz class dances.
Oh, so good.
So I went and fulfilled what that dream really represented, which was creative movement.
Yeah.
Right. And controlled movement and beautiful movement.
I love that. Yeah. No, you know, I was talking with a friend literally last night who's, you know, feeling a little bit overwhelmed. There's like a lot going on. And I was kind of saying the same thing. I'm like, hey, how can you line up all the things on your plate? Right.
Yeah.
And and focus on, okay, these are things that are the most important. Like these things are non-negotiable. They need to happen. Right. But then like, again, going in those tiers, what were they again? What were the 3 tiers you said?
Yeah. So things I want to do,
Mm-hmm.
things I don't want to do, and
Yeah.
things I would love to do, but never will.
Yeah. Right. And I mean, I think in her case, I would add categories of like, here are the things that I have to do.
Yeah.
Here are the things that I want to do. Here are the things I'm doing because someone else is expecting or depending. You know what I mean?
I think that's really important to tweak like that, because is she a mom? Is she a parent? Is she a family member?
Oh my gosh. Yep.
Yeah. So there are obligations.
Right.
And,
Right.
when we have obligations and responsibilities because of the role, say, of parent, right, or a caregiver, you can't really step out of that.
Yeah, exactly.
So how do I organize all of those aspects in a way that I see them and can feel more calm about them?
Right, exactly. Yeah, I actually gave her the example. Oh my gosh, I have a neighbor who's also a therapist, and we have the best conversations over the fence. And I just love hearing her wisdom about things. Someone asks her to do something, and she's just feeling stressed about it. And she says, I don't have enough spoons for that. So apparently there's something called spoon theory. I don't know anything about it, but she's like, hey, here's my cutlery drawer. I've got 10 spoons in here. That means, you know, I can feed a few mouths, or I can use it to dig a garden, or I can use it for stirring something. But like, I've only got the 10 spoons. Once those are used up, there's no more, right? This is all I've got to use. So I think it's a way of recognizing the capacity that you have, right? And I think that's an aspect of mindfulness, is just being aware of your own capacity and being able to kind of scale things back so that you can have plans that are realistic and goals and dreams that are realistic. And, you know, it's still, when it comes to like aspirational things like the ballet dancing one, those are great dreams to hold on to, right? Like you don't need to check those ones out. But again, I don't have enough spoons for that right now. You know, I don't have the 10 hours a day to practice.
Well, and spoon theory is about like daily life. And I have found with clients who struggle with their daily active living, it's a great metaphor to give to members of their family, whether it's their parent or their sibling, or if it's their spouse, because they're in that kind of family situation. And they're saying, listen, I know that we have all of these things that need to get done. And I know that I have my role here, but I have limited capacity. And if I share my spoon theory with you, like, hubby, today, you know what? I have 5 spoons. Maybe my pain is too great. Maybe this person's in chronic pain. Maybe they have fibromyalgia and it's just worse this week.
Yeah.
And so it's a great communication technique too.
Yeah.
This is what I'm able to offer. And then the person they're in a relationship with is like, okay, how can I add more spoons, or how can I give you the space that you need to only use the spoons, and do you need to use all of them today?
Right. I think I heard Brené Brown talking about something
she probably
similar.
did. Yeah.
Something similar, but she does a percentage. And she's like, my husband and I, we're just checking in all the time, right? We're saying, hey, when it comes to like energy that I have to give, or like amount of caring that I can offer right now, like I'm at honestly a 50% right now, like, or 40%. And I just need space right now to just like recollect and get back up to, you know, 80, 90%, so that I can give back again. But right now it's low. And so they're always checking in and communicating that. And I think it's a really interesting strategy.
Oh, I love it. It just builds healthy relationships. And you mentioned boundaries. Yeah. That's when we are aware of what our capacities are and what my daily capacity is, because every day looks different. Maybe today I'm like, it's been phenomenal. Like I had a great morning, like nothing seemed to stress me out. But then tomorrow I had another great day, but I didn't have as much joie de vivre. Maybe it was just I learned something different about somebody and it dragged me down a little bit, or maybe I'm going through seasonal affective disorder. Yeah. When I become very clear about where I am at mentally and energetically, I get to then communicate that with the people around me, and it helps to build healthier relationships. Yeah. And mindfulness can contribute to that. When I take the time to sit quietly. I actually get to hear myself. And she's like, hey, this is where you're at right now.
Yeah.
You know what? This is what you need.
Mm-hmm.
And I'm like, oh, you know what? I didn't hear myself because I was so busy.
Right. Yeah. How do you help clients to get there in that ability to check in? I'm just thinking about when I get up in the morning, like our house is insane.
Mm-hmm.
Like we got 4 little ones. And honestly, sometimes I've been up for 2 hours and I'm like, drink a glass of water for goodness sakes. Taking care of basic things, it's hard because there's a lot of demands and there's like, hey, we got to get the kids to school and all that stuff, right? How do you build in that ability to check in with your mental health or check in with yourself and say, here's where I'm at right now, right?
Yes.
What do you recommend for clients?
So I love that you use the phrase build in, because I make a very cognizant point to not tell my clients what they need to do. My approach to therapy is completely person-centered. So my gift that I bring into sessions is to sit with my clients and have them hear themselves. I truly believe that you know what is best for you. Maybe you don't have the information that helps you see what is best. Perhaps there's a reflection that would be valuable in shifting your perspective. And those are things that I can give to you. But I will not sit with a client and say, okay, your morning is busy. You've got 4 kids. What if you wake up earlier?
Right.
Right? I will not say, well, why don't you just stop at the kitchen sink and have a glass of water? Because it's coming from me.
Yeah.
My client can say that themselves. What I do instead is talk with them. Well, tell me about the morning. Walk me through what it looks like for you.
Yeah.
Do you see any moments where you could pause for yourself?
Right.
And sometimes they say, well, you know what? Like, when I'm brushing my teeth, I could probably take like an extra 30 seconds.
Yeah.
I'm like, oh, cool. Is that really possible? And they say, yeah.
Yeah, I like that. I think, yeah, just like the busyness, right? We forget about what we've learned in therapy and we forget about what we've heard. And so like having a point where it's like, it's already piggybacking a normal routine thing, like brushing our teeth. Like hopefully we're remembering to do that.
Yeah, hopefully.
Well, I mean, some people are very depressed or whatever, and they're just like not even getting it, right? But yeah, like attaching those mindful moments to something that we do regularly. And at first, it might be difficult for us to remember, but over time we're like, hey, I'm enjoying this extra 30 seconds of brushing my teeth. and it becomes something that comes more naturally, I think.
And I think part of what makes change so accessible is when it comes from the person themselves.
Right.
There are some people and some clients who are very much like, listen, like, I need you to give me a suggestion. And I'm like, if you really need it and you want it, like I have one, I'll give it to you. And maybe that works for that person.
Yeah.
But when we determine on our own what shifts and changes can work for us, then we're more likely to remember them and to do them.
Absolutely. No, and I mean, I think as a therapist, you could give examples of things other people have found success with, right?
Yes.
And they can take it or leave it. They can say, oh yeah, that really jives with me or not. Sarah, I'm loving this talk about mindfulness, and I'm just really enjoying the experience that is coming behind what you're sharing. I want to know how you measure progress and effectiveness of mindfulness interventions with your clients.
Yeah. So there are different ways to measure change for clients. Sometimes, like if you're taking, say, like a CBT approach and they're filling out worksheets, the worksheets themselves sort of like show what has shifted, what has changed, what thoughts are changing. And then clients themselves realize their AT, their automatic thought, is not happening as quickly. The negative automatic thoughts are not happening as quickly. The ways that I measure progress and effectiveness of mindfulness with my clients is by checking in with them. One thing that I have found very useful within my sessions is at the end of every session, I ask my client, how was this session for you?
Yeah.
Another kind of variation I have of that is, what would you like to take away from today's session? And in leaning into again, that idea of that person-centered approach, of having a client bring forward change and thoughts from themselves. When measuring the effectiveness of mindfulness, I just ask,
Yeah.
what have you noticed has been different for you since you started taking those 5 minutes in the morning?
Yeah.
Do you see how that has changed the way you've felt when you have arrived at work? I know it was really hard for you to feed your toddler in the high chair because they were just throwing food and you're feeling frantic and you had to get to work and now your clothes were dirty. Was there a shift in how you felt about that same situation on the days that you did take 5 minutes to yourself? And in having that conversation, my clients were able to recognize that there's been an improvement in how they feel.
It's qualitative data, right?
Yeah.
It's experiential. And I mean, I've heard this from other therapists. They're like, if someone's feeling good, if they're noticing there's been positive changes in their life, you don't really have to pull it out of them. They're coming into session and they're just like beaming about it. They're bursting with like excitement.
Yes.
Like, hey, that thing we tried, it's working. I'm feeling so much better because of it.
I love that. I just love it. I get so giddy with excitement when clients have immediate success in their change. And not all of us do. Like even I don't, with the things that I want to change as a person, you know, I'm not just a therapist. And when I have a client who comes in and they're like, everything feels so much better because of this like one thing that we've been doing and working on together, I'm like, that's amazing. I'm so excited for you.
Yeah, that's amazing.
Yeah.
Oh, I love it.
Yeah. How do you want to maintain it? What do you want to look at next?
Yeah.
Yeah.
That's great. No, and I guess the flip side, I mean, do you have clients come in and they're like, I tried that mindfulness and I can't get the hang of it and I'm so frustrated?
Yes. So earlier on, like when I was, say, like in practicum, right? Like earlier years of being a therapist, I would give suggestions and I wouldn't take the time to get to know who my client is and how they work as a person. And so I would give suggestions that were not attuned to the individual. And so a client would come back, they'd be like, that didn't work. I'm like, oh shit.
Yeah.
We got to try something else. But then that erodes their trust and their faith in either their ability to change, or if they've put it in me, in my ability to help them change.
Absolutely. So I can understand why you don't want to be giving suggestions as a therapist of like prescriptive suggestions, right? And saying do this and this and this and you'll see change.
Yeah, it's just not my vibe either, right? And like the word prescriptive I think is really accurate because we have these, we have, you know, empirically evidenced, tried and true strategies and interventions and tools for clients. And like, yes, 100% these things work. Do they work for you?
Right.
And if that strategy is going to work for you, how can we tweak it so it's like exactly for you?
Right. Because it's not just understanding something from the textbook. It's like actually being able to apply it into your life and live it out and experience it. Right.
Yes.
Yeah. One last question while I've got you here, Sarah. I'm curious about ethical considerations of incorporating mindfulness into your practice. Are there times where using it presents risk to the client?
Yeah. So in cases of trauma, if I'm asking a client to start to be more present and start to be more in touch with, say, the tensions in their bodies or the thoughts that they're avoiding, it can bring up those traumatic feelings and sensations that they're not ready for.
Yeah.
And so it's actually so important to recognize what state of change is my client in and what is their capacity for moving into trauma.
Yeah.
And what kind of supports have we built up around that so that when they move into it in session and then carry that work outside of session, that they're fully supported.
Absolutely. Yeah. I've heard of cases where it's like complex trauma kind of stuff, right? And, you know, you're trying an approach with a client and you try something and it like really doesn't work. And the client either freezes completely, shuts down, or goes completely off the wall, right? Has like a very extreme reaction to what's going on.
Their nervous system just completely takes over.
Mm-hmm. So yeah, there are cases I would say that checking in, maybe they're not ready for it. Maybe it's not the right approach to checking in, right?
And even that level and that leveledness of mindfulness.
Mm-hmm.
Well, perhaps it's just that observation piece first.
Yeah.
And then that opens up, oh my God, like I totally forgot that this thing had happened to me when I was younger. Like I kind of suspected, but like I really feel it. And that's huge.
Mm-hmm. Mm-hmm.
It's really important a client comes back to session, shares that, and then we're like, okay, are we going to move into that right now? How are you going to feel supported in moving into that right now? What is that bringing up for you before we even move into it?
Yeah. Mm-hmm.
And then as a therapist, what are the risk factors involved in them as a client? Like, are they actively suicidal? Do they have a history of suicidal attempts? Do they cut? Or do they struggle with addictions?
Mm-hmm.
Had they been considering moving back into an addictive pattern?
Yeah.
And all of those need to be addressed before I say, hey, let's really get into the traumatic stuff. And let's utilize, that space and that presence and that mindfulness to open it up.
Right.
You don't want to just do that.
Yeah.
It can hurt someone.
Yeah, for sure. No, and that's where like, oh my gosh, if I have inquiries coming in, people are talking about trauma, I'm like, we're going to make sure you're going to someone that's experienced, right? Like you got to find the right therapist for this. It's not just pick anyone, because someone that doesn't recognize the risk, they might just go there. They might just go to that pain, and it could actually send someone backwards on their mental health journey and, actually cause more damage than it's worth. I love that mindfulness can actually be used even in the cases where someone is shutting down or, having that kind of freak out moment, right? In trauma. There's other tools in mindfulness. Like I love the one just using your 5 senses. What's something that you can see right now? What's something you can smell right now? What's something you can touch, right? And it's just bringing awareness back to the present.
Yes.
I'm here. I'm okay. Like I'm not in that trauma at the moment.
Yes.
And just like, coming back to your senses, literally.
And regulating yourself.
Mm-hmm.
And once you're able to do that and you get to this place of ease and coming back to your senses and regulating to the present moment, then you're able to think, well, what sensation was I experiencing in that moment that is very similar to and reminded me of that traumatic event?
Yeah. Yeah.
And then we have a whole door that we can open.
For sure. We're out of time for today. Sarah, this has been fantastic. I love hearing your thoughts about mindfulness and just your take on it and how you're using it with your clients. This has been Beyond the Session. We are brought to you by Reset Counseling and Psychotherapy in Barrie. Thanks for coming in today, Sarah.
Yeah, absolutely.
And we look forward to seeing you on the next show.